Thank you so much, and thank you, Hindi team. Now it is the time for the English session. We'll start with a silent prayer. Welcome everyone for today's English session. Today is our 1472nd day of continuous webinar. Thank you so much all the participants for joining with us. And I'm thanking all the faculties, those who are sharing their knowledge here. Thank you so much. And today's our guest is Dr. BIBHU Prasad Panda. He's MD in homeopathy, and he's a principal and hospital superintendent in Parole Institute of Homeopathy and Research in Vadodara. And he has 31 years of experience, clinical experience, and 28 years of teaching experience. Worked as a HOD in the Department of Organ. Not only as HOD, he worked as a lecturer, professor, then HOD and superint. Many positions. Actually, if I'm I'm saying one by one means we need one full webinar for to say his experience. So participants all must go through his experience. That you must know that how eminent personality is taking class today for IFPH. So he worked as a superintendent in Vadodara, and he worked in many universities in Raipur, Bhopal, Rajkot. Many articles published, many papers presented, and conducted many seminars nationally and internationally. And we got a chance to hear from Dr. BIBHU Prasad Panda. Doctor, you're welcome to IFPH. You can now start. Dr. BIBHU Prasad Panda.
Am I audible?
Yes, sir. Yes, you are audible. Yeah.
Thank you, madam, for your nice introduction. Actually, you introduced myself in a exaggerated form. I am not like that.
Not exaggerated. Actually, I have no time to read all these things because they will miss your speech. So actually, they must know that what kind of personality we got for today's session. You are welcome, sir. Thank you.
Thank you, madam. So, good evening to all the dignitaries and the executives of the webinars. And I am very much thankful to Sani sir for giving me chance to share my views among the stalwarts those are present and those are listening to us. Now I don't want to waste time. Just I am going to share my slide and let us start. So my screen is visible.
Yes. Local diseases at a homeopathic and its homeopathic approach. It's visible.
So thank you very much again. So let us start. In homeopathy, actually there cannot be any local disease as per the holistic concept, but to convince the disciples to satisfy the conventional medicine, Hahnemann classified disease in 5th edition of Organon in 1833. So in classification, Dr. Hahnemann has written that it comes under your chronic disease having few developed symptoms. So chronic disease having few developed symptoms are again divided into two parts. One is your internal complaint, another is the external complaint. Internal complaint means the complaint, the cause which is internal, that is miasmatic. But in case of external complaint, again the manifestation appears in the external parts. So when the manifestation appears in the external parts or organ, then it is called local disease. So local disease in view of homeopathic, how we have to deal it the local disease, how will you treat it, how will you manage it, how will you take the case, everything will be discussed one by one. So the points to be discussed here: introduction, what I am telling to you, then classification of diseases, it is necessary, then local disease with external cause, its management or treatment. Actually, local disease with external cause means it may caused by any external injury, accident, burns, scars like this, and internal cause, it may be miasmatic cause, it may be any type of immunal disturbances. Then local disease with internal cause, its management and treatment, role of external application in the treatment of and management, then conclusion. So this is the classification of disease which has been described by Hahnemann in Organon of Medicine from 72 to 82 aphorisms. So classification is nothing that is mental grouping of facts and phenomena to on the basis of the similarity or dissimilarity to solve a particular purpose. It is a mental grouping for our understanding. So the it comes under one-sided disease because the manifestation appear in one-side manner. It does not cover the body as a whole. That does not cover means not holistic point of view, where the manifest because of the nature of the manifestation, it appear in a side of the body, in a particular part of the body, in a particular organ of the body. That's why this is called one-sided disease. But as per homeopathic concept is concerned, no disease can be one-sided because the body in healthy condition work as a unity, and in disease condition it can't work separately. The hands have no value if it is not included in the body. So there is trinity of life, that is your vital force, then body and mind. And when all the things they remains in equilibrium condition, then it is called healthy condition. And all the organs, they work as a unity to get an outcome. If any organ will suffer, though the manifestation will not appear in the other organs, but they will compensate. So if there will be eczema, then definitely our mind will be engaged there and it will be disturbed. We will not able to do our regular routine work also. So as per homeopathic concept is concerned, no disease can be separate. No disease can be treated separately, but because of the nature of manifestation, just to make aware to the conventional medicine to the people, that is named as local disease. So this disease comes under one-sided disease having few developed symptoms, external complaint. That's why it is called local disease. Local disease treatment has been written between the aphorism 185 to 203. So how we have to take the case, how our approach should be, how will you frame the totality of symptoms, after how will you perceive the symptom, in which way you have to perceive the symptom, by which the correct synonymum can be selected. So everything has been written precisely between aphorism number 185 to 203. What old school understand, or what is the concept of old school theory as per local disease is concerned? They consider the local disease is only concerned to the part in which it is manifested. Only the external parts which is affected, as per the old theory, as per the conventional medicine. For example, a person is suffering from an ringworm in the dorsum of the hand. So they consider that it is a disease which is concerned to the hand only. Other organs, other parts, they are not included. That's why what type of treatment they adapted. They apply external ointment, liniment, and concerning to that part, they treat the defect what occurs because of the palliation. The repeated palliation causes suppression. So the local disease which appeared, which is the manifestation of internal miasmatic manifestation, internal cause, that distinctive part is removed and the disease enters inside the body and affect the vital organ. For example, eczema is suppressed, eczema is palliated, then it goes, the asthma occurs. That means it affects the lungs and it manifests in the vital organ like lungs, and the treatment becomes more critical, more difficult. So this is the defect. So, and again, if the wart is present, then that is the symbol, that is the distinctive sign of psychotic miasm. So we should not consider, we should not treat or remove by any means the wart. We have to consider the body as a whole. We have to take all the mental, physical, all the signs and symptoms, and we have to select a medicine not on the basis of appearance of the manufactured part. We have to select a medicine which covers both mental and physical. We have to perceive what is to be cured in this disease, as written by Hahnemann in aphorism number 3. In aphorism number 3, Dr. Hahnemann has mentioned clearly that the physician should perceive what is to be cured in the disease. So we should not remove the effect. We should not remove the product. We should not consider the aid. We should consider the cause. We should consider the process. We should consider the beginning. We should consider the world of thought. Then only automatically the effect, the product, the aid, the world of matter, it will be removed. So this type of concept, every homeopath should be considered, and accordingly the disease to be perceived and treated. So you should not follow the old school theory, because if you follow the old school theory, then it will lead to palliation first. If you palliate repeatedly, then automatically it will lead to suppression, which is more dangerous, which affect more vital organs. When it affects more vital organs, the case will be more complicated. So local disease produced solely by the external lesion. Yes, in 186 aphorism, Dr. Hahnemann has written that local disease which is produced by external lesion. For example, if the local disease is produced by burns, if the local disease is produced by scars, if the local disease is produced by any type of blunt instrument, in those cases, because they are not natural, so we have to take the help of external application. We have to take the palliative treatment along with your homeopathic medicine. For example, a person is suffering from blunt injury, then arnica we have to prescribe if there will be no the injury is there is no bleeding. But apart from that, for soothing purpose, we may take the help of external application. So these are some examples of local disease with external cause. Scald, then burns. In those cases, we can apply Cantharis mother tincture externally also, and internal medicine we can take, because the cause is not natural. Homeopathy has a great scope where the origin is natural, because our system is based on nature's law. So where the diseases are originated from nature, in those cases we have to treat only taking the help of your homeopathic medicine. There is no need of external application. External application is strictly prohibited. Rather, it do harm where the diseases are originated from nature and from internal cause. For example, a chancre appears in the male penis. Then that chancre should not be treated by external application. It needs antisyphilitic medicine. When we will prescribe antisyphilitic medicine, automatically the chancre it will be removed. Yes, Hahnemann has written in syphilitic miasmatic treatment. Chancre is the distinctive or characteristic feature of syphilitic miasmatic primary manifestation. When the primary manifestation of syphilitic miasm is present, in that cases, we should not apply any type of external application. When a suitable homeopathic medicine will be prescribed, then internally from inward, following the Herring's law of cure, that means from inward to outward, from above to downward. So following the Herring's law, reverse order of their appearance, the disease will be removed from internal to external, and when the disease is removed, automatically the chancre will be cured, and until and unless the spot of the chancre is removed, we have to understand the disease has not cured. So only simple medicine, antisyphilitic medicine, that is Marshal, one dose is required to cure this. If you will apply external application, if you will remove the chancre or BIBHU by cauterizing or corroding by external ointment or liniment, then what will be happen? It will lead to the primary manifestation of the syphilitic miasm will be suppressed. When the syphilitic primary manifestation will suppress, the syphilis goes to its latent stage, and when the vitality will be weak, then by any type of severe acute disease like your severe fever, then bloodletting, any type of injury, then the latent syphilis will get the chance, and it comes with its secondary manifestation in dangerous form, and it produces destructive type of diseases. So where the cause is internal, we homeopath, we should not apply any type of external application in the form of liniment, in the form of ointment, or any other lotion, only by suitable homeopathic medicine selected on the basis of totality of symptom, on the basis on the concept of individualization with proper dose and potency. The medicine must be prescribed considering the susceptibility, then the radical cure occurs. Otherwise, the radical cure does not occur, will ruin their case. That's why where the external cause, the injury, the local disease is because of the external cause. In those cases, we can apply external application along with our homeopathic medicine. But where the cause is internal, we shouldn't apply any type of external application, any type of lotion, any type of liniment. Only by suitable homeopathic medicine we have to treat the cause, treat the disease, because in concept of holistic point of view. Then old school treatment, what they do, they only deals with the external part, and they remove the wart or cauliflower like growth in case of psychotic miasm. When the cauliflower like growth or is removed by application of caustic, by removed by any type of surgery, then what happens? We lose our distinctive feature, that is cauliflower like growth or what in genitalia. In case of male, a gland penis. In case of female, that is in pudenda. We lose our distinctive feature. We will be confused and we cannot treat properly. So, if we follow the old concept, that is the disease only present in the local part where we are seeing, and we consider only that local part. Again, I am telling that local part cannot exist separately. It is it has joined with the body, and all the parts, organ, system, function, they act as a unity to get an outcome in health as well as in disease. This concept should be there. So external application is required in case of the local disease which appear because of external injury, external cause. And again, in internal cause, the external application help can be taken for soothing purpose, but that should be non-medicated substance. For example, there is cracks. In case of dry eczema, where we select petroleum, so petroleum jelly can be applied, which is non-medicated, only for soothing purpose, because the cracks gives pain to the patient. So to get relief in non-medical, even the coconut oil can be applied for soothing purpose, but we have to prescribe medicine for that particular particular medicine on the basis of totality of symptom. One single symptom can be a totality symptom, and thousands of symptoms cannot be totality of symptom. So you should have clear concept about totality of symptom. Keynes already mentioned that if you are collecting hundreds of symptoms and those hundreds of symptoms are not helping us to select the medicine, that hundreds of symptoms or some aggregate of symptoms cannot be called totality of symptom. Only single symptom, if it helps us to find out the medicine, that can be called totality of symptom. For example, each appear each year when winter approaches. Each appear each year when winter approaches. Yellow sucrotina is the medicine. So that single symptom, that is characteristic symptom which helps us to find out the medicine and you can treat properly. So where the cause is internal, we should not apply any external application. Only for soothing purpose, we can apply glycerin, we can apply uh, Vaseline, we can apply our coconut oil, but not any medicine or any type of lotion which is medicated. Only by internal application, automatically the disease will be cured. And if you treat the local disease, considering the local, it affects the local part, then it is dangerous, it is pernicious. You are going to ruin your case because it leads to suppression. As I told, the ringworm is suppressed, asthma appear. So the pemphigus is suppressed, then it leads to gastritis. So this type of pernicious disease we will invite if you apply external application, and considering the local part, we will select a medicine, then these things will appear. So where the cause is internal, we never select a medicine on the basis of the part affected. We have to select medicine which cover the body as a whole. Of course, I am giving example. A person is suffering from throbbing headache, and the throbbing carotid, and that headache is aggravated by sun. So this type of headache a person is suffering. But after a thorough investigation, if we observe that the headache is appeared because of the insult, the headache is appeared because of the bad effect of insult, then you may think about staphysagria. So we have to take the qualitative symptom, and when staphysagria will be prescribed, then the headache will be cured, though it is throbbing, because throbbing is the result of internal cause. So we are taking the effect, we are not considering the cause, that is bad effect of insult. So we should consider the bad effect of insult. On the basis of that bad effect, we have to prescribe staphysagria, then the headache will be cured. So only considering the local symptom, as the old school physicians, they think it is a blunder mistake as stated by Hahnemann in aphorism number 188. Then these are some examples of local disease, and they should not be treated by local application of ointment, liniment, and any antifungal medicine, whatever it may be. So these are the examples of Shankar which I have already given. And the three primary manifestation, that is eruption in case of Sora, itching eruption, cauliflower-like growth, or what in case of psychosis, then your Shankar or BIBHU in case of syphilis. So these are the primary manifestation. Hahnemann has clearly mentioned when the primary manifestation has been existed, in those cases, only by prescribing 1 dose of sulfur is sufficient to eradicate the disease. Only a dose of thuja or nitric acid can eradicate the disease, and only 1 dose of Berxol can remove or establish radical cure. But that Shankar, that what or cauliflower-like growth, that eruption, if it will be palliated, if you will apply external application, then the primary manifestation will suppress. When the primary manifestation will suppress, the miasm go to its latent stage, and in latent stage you will not get any type of symptoms, because our vitality is strengthened enough. And when our vitality will be weak because of any severe acute diseases like typhoid, like measles, etc., then the vital will be weak, and the latent, the dormant, the sleeping miasms, they becomes activate, they appear externally with its secondary manifestation in form of Sora. It will produce different type of functional diseases. Psychosis produce infiltrative and proliferative diseases. Syphilis, it produce destructive diseases like osteoporosis. Psychosis produce infiltrative like fibroid, like any growth, it will produce. Any tumor, it will be produced. So we should not apply external application to get rid from the local disease where the cause are internal. Consideration of internal cause, always you have to consider the internal cause. Hahnemann has emphasized and written in 189 aphorism. That may be that local disease wherever it appears. As for example, living one appear in the upper part of the body. In Metromedica, sepia has been mentioned, but only considering the ringworm in the upper part of the body, it will select a medicine. That medicine will be palliative medicine, because we did not consider the uncommon, peculiar, rare symptom what is advised by Hahnemann in aphorism number 153. So in 153, Dr. Hahnemann has advised that always we have to take uncommon, peculiar, rare, indistinct pictures, that is characteristic symptoms, to select a medicine. So where the cause is internal, we have to consider the characteristic symptoms. We have to select a medicine. It may not cover the external manifestation, but if it is covering the cause, then automatically the effect which appear in form of external manifestation, that will be automatically removed from the body. So this concept we should have, and we should treat the local disease accordingly. So I have already described what is the primary manifestation of syphilis, that is venal chancre, primary manifestation of psychosis, that is cauliflower-like growth or warts, primary symptoms of psora, that is itch vesicles. So holistic approach should be, what is holistic approach? Holistic approach means we have to consider the body as a whole, as a single unity. So in holistic approach, rather in case of physical disease, we have to consider the mental symptoms are more powerful and more important if their characteristic features. As for example, I am telling that the simple example I am taking, that a person after exposure to northwest wind, if he is suffering from fever and with the mental symptom, predict the date and time, then aconite is the best medicine. So aconite is the selected medicine. So holistic approach means always you have to consider from head to foot, mental, physical, all the symptoms we have to take, as mentioned by Hahnemann in aphorism number 6. The portrait of the disease is formed. How the portrait of the disease is formed? By taking the subjective symptoms which are expressed by the patient, by taking the objective symptoms which are collected from the attendants, from the relatives, and by physician himself, and by means of different investigations, imaging, they are also considered, because they are all objective symptoms. So you have to consider all the imagings, all the investigations as objective symptoms, and objective symptoms which are collected from the attendants, relative, and physician himself, and subjective symptoms from the patient. And when all the symptoms and signs, they are logically arranged, which helps us to find out the medicine, then that is the real portrait of the disease which we have to form. On that basis, we have to find out the treatment. We should not consider the pathognomonic symptoms. The pathognomonic symptoms are the symptoms which are related to disease, like polyuria, polyphagia, and polydipsia. So polyuria, polyphagia, and polydipsia, they are the pathognomonic symptoms, disease symptoms. We can select our homeopathic medicine. But if a patient, though he is suffering from polyuria, polyphagia, and polydipsia, but the patient is having weeping disposition, changeable mood, likes open air, thirstless. So if this type of characteristic feature we are getting, then rather in that case, our pulsatilla is the best selected medicine. So we have to consider the body as a whole on the basis of individualization, on the basis, yes, on the basis of individualization means that medicine which is selected for a given patient may not be the medicine for other patient, because the susceptibility differs from person to person and in the same person even in different time. For example, I am suffering from diarrhea after taking fatty food, after taking oily food. Now the medicine for my diarrhea will be pulsatilla. But after some days, again, if I suffering from diarrhea after taking spicy food, after taking meat, mutton like this food, and the medicine may be Naxvomica. So susceptibility differs from person to person and in the same person in different time. That's why the homeopathic specific medicine differs from person to person and in the same person in different time. On the basis of holistic point of view, this type of consideration we need to do to treat the case. Then we can treat radically. We can fulfill the second aphorism. We can fulfill the mission, and the cure will be highest ideal of cure are described by Hahnemann in aphorism number 2. Holistic approach, here I have drawn a diagram. We have to consider the intellectual part, we have to consider the emotional part, spiritual part, and physical. When all the symptoms they are collected, organized, and placed in organized manner, and we form a portrait. That portrait is nothing. That is our disease itself, and the medicine which covers that portrait, that means same portrait in the medicine which we are found, that medicine should be prescribed. Yes, this is the totality, because what we are doing for the playing of a boy, we are giving different blocks. What the boy do? He organize, place all the blocks and form the elephant from different structure. Likewise, the symptoms and signs which are explained by the patient, that they are haphazard. So our aim and objectives, we have to take those signs and symptoms which can be compared as a block, and you organically place all the blocks in such a manner which helps us to form a portrait. And considering the portrait as the real disease, we have to select a medicine that may be local, that may be fully developed, whatever it may be. The local disease, just name is given because of manifestation, but whole body is involved when the person is suffering from any type of local disease. So we should not keep in mind that there is any local disease in homeopathy. For our understanding, it may be local disease, but there is no local disease separately. Restoration of health of entire body, disappearance of external affection. 191 aphorism. When a medicine is selected on the basis of holistic point of view, and that medicine which is selected, a proper potency and dose should be find out on the basis of susceptibility. If that medicine will be administered in proper repetition will be done, then what will be happen? The disease will be cured. As Hahnemann is mentioned in 246 aphorism. In 246 aphorism, Hahnemann has mentioned we have to fulfill 3 conditions to establish a radical cure. That is simillimum, then dose and potency, then repetition. Only by selection of a medicine for a given case, you cannot establish cure. The simillimum, if it will not satisfy the modified susceptibility because of the disease, it cannot cure the case. So after selection of the medicine, after selection of the simillimum, we have to select the dose and potency on the basis of the susceptibility. If the person has high susceptibility, we have to select medium or higher potency. If the person is having low susceptibility, we have to select low potency. So if the potency will be incorrect, then it will not work. Second thing, only selection of potency and simillimum, they cannot cure. Our repetition must be correct. We have to repeat as per the nature of the disease, as per the nature of the patient, as per the nature of the medicine. Considering all those 3 points, we have to repeat the medicine. Then only the radical cure established. And when an internal medicine is prescribed with internal disappearance of diseases, the external external manifestation will be automatically removed. Until and unless the external manifestation is removed, we should think that till now the cause has been persistent. Example I am giving, if the chancre is removed after prescribing internal medicine like mercurius, then what happens? Slowly the chancre, the ulcer will be healed, and at last what happens? The pink color will be there, and that pink color which remains in the area, that is the indication of existence of syphilis internally. So when the medicine should be repeated, when the medicine will continue, automatically with constitutional development, with internal development, the patient will feel easy
It's
and
not
comfort. Yes.
Slide is not moving. Now the slide is outcome of holistic approach. You are moving the slide, right?
Yes, yes. I am moving the slide, madam.
Yeah, now case taking.
Yes,
One,
let me continue.
yeah.
So about the case
Slide,
taking of, yes.
Taking 192.
Yes, 192 aphorism,
Okay.
investigation of the case of disease. So
Okay.
the investigation of the case of the disease in local disease, like investigation of the case of the disease in any chronic diseases, we have to consider the history, family history, everything we have to consider like a chronic disease. So case taking chapter, in case taking chapter, Hahnemann has described between the aphorism number 783 to 104 that we have to follow the special direction, we have to follow the general direction, we should not interfere, we should collect the case as the language of the patient, everything we have to collect the obvious cause, everything we have to consider as we are considering in case of case taking of chronic diseases, and in local diseases same procedure should be followed, and we have to form the portrait and select a medicine by which you can establish highest ideal of cure. So local malady, yes, we should not consider local malady as separate one from the body, because no part can exist separately, written by Hahnemann in 193 aphorism. So in case of local malady, we considering it is one of the symptoms or sign which belongs to the whole portrait. So other sign, other symptoms, they should be collected. Other symptom and sign of in case of local disease, for example, it is the manifestation is in form of eczema, the manifestation in form of ringworm, the manifestation is in form of erysipelas, whatever it may be. So that is not so important. So other things in mental sphere we have to collect, rather they bears more value, and all the symptoms should be considered, and they will be organized placed, they will be logically placed to form the portrait. On the basis of that portrait, the simillimum is selected, that simillimum must be administered with proper dose and potency. On the basis of susceptibility, the repetition must be perfect, then only the highest ideal of cure will be possible. We should avoid external application, written by Hahnemann in 194 aphorism. External application is strictly prohibited in case of local disease. If you will take the help of external application, it will lead to palliation, give temporary relief, and repeated palliation, as I have already told, it causes suppression, and when the disease is suppressed, always suppression go to deeper part, it affects the vital organ, the case becomes more dangerous and critical, and it goes from curable to incurable state. That's why we have to avoid any type of external medication. In case of treatment of local disease, we have to give only internal medicine. Oh, that should be minimum. That should be administered in proper dose and potency and repetition. Of course, in 6th edition of Organon, Hahnemann has cleared the repetition, introducing the 50 millisievert scale. In 50 millisievert scale, the problem of repetition has been removed. You have to start from 0 by 1 potency, and until and unless the cure is ensured, you have to repeat the medicine 0 by 1, 0 by 2, likewise. So the repetition problem and the unnecessary unwanted homeopathic aggravation can be avoided if we will administer 50 millisievert scale or LM scale, because in that the minimum, the medicine is very minimum, and that is the latest potency introduced by Hahnemann. So 50 millisievert scale potency is best to treat the local diseases, to avoid unwanted aggravation. Yes, we need homeopathic aggravation, slightly intensification of the existing symptoms of the disease while the patient feels better. But to minimize the homeopathic aggravation, the minimum dose should be prescribed. What is minimum dose? The minimum quantity of medicine which should be prescribed, which produce least possible excitation in the vital force and remove the disease force. So that concept in pharmacy, somewhere it has been written, minimum dose is the one that is 1/100th of a grain. So that is required only to ignite, only to start the process of cure. Actually, in secondary curative action, the vital force itself establishes the cure. In primary action, the disease force is removed. In secondary action, curative action, vital force overpower the medicinal force and cure is established. At last, if you will analyze, then vital force itself cure the disease. That concept should be applicable not only in chronic disease but also in local disease, because local disease is nothing, that is the type of one-sided disease that comes under chronic disease having few developed symptoms. So always you have to keep in mind. So where the local disease is sora, then you have to select antisoric medicine. Where the local disease is syphilis, we have to give anti-syphilitic medicine. So if we will select proper anti-miasmatic medicine, then the miasm, the disease producing power, the fundamental cause, the prima causa morbi, when they will be removed, automatically the external manifestation of the internal dyscrasia, that will be removed and the health is restored. So we only after giving the medicine, we have to follow the Kent's remedy reaction. If it has been clearly mentioned, repetition is contraindicated when the case is improving. If the patient gets relief, we have to wait and observe, and we have to counsel the patient that your disease has been started before 10 years. Why you are expecting that it should be cured within 3 days? So you have to wait, and you will get benefit, and it will be rooted out. It will keep patience. That's why this type of counsel you have to give to the patient, and when the internal medicine, proper medicine will be administered, then the previous health will be regained. So total restoration can only be established by internal medicine where the cause is internal. And if you'll analyze most of the local diseases, they are soric in origin. Seldom they are complicated with syphilis, but they are soric in origin. So proper antisoric medicine should be given. Potency, if you prescribe the 50 millisievert scale, then potency problem is solved, repetition problem is solved, unwanted homeopathic aggravation problem is solved. So we have to encourage the newcomers. We have to encourage the our children, our followers to start practicing with 50 millisievert scale. Simultaneous administration of internal and external remedies, it has been written in 196 aphorism. If we prescribe medicine simultaneously, internal medicine and as well as the external application, it is again dangerous, because of external application of liniment, ointment, whatever medicine, then what will be happen? The distinct part, the identity of the internal existence of the miasmatic disease, that will be removed in fast. So when the manifestation of external manifestation will be removed, then how can you able to know that that disease has still been existed? So it is our responsibility not to remove the manifestation by application of external ointment, liniment or lotion, only by internal application of medicine. When that external manifestation, local disease is removed, it will be removed slowly and the natural skin returns. It indicates, this is the indication that disease has been clear. So simultaneously external application and internal application is strictly prohibited. Of course, in footnote number 282, Dr. Hahnemann has mentioned clearly that in old cases of wart, where the wart is very chronic, in those cases, Thuja mother tincture can be applied with internal administration of Thuja. So in 282 aphorism, Dr. Hahnemann has mentioned, but in rest of the cases, you should not apply, you should not take the help of external application with internal medicine. It will disturb your case. It has been written in 196 aphorism. In 197 aphorism, so disadvantages has been written that it looks like cure, but that is not cure. It is suppression, and the suppression always leads to dangerous and the case from curable to incurable stage. So, and when you remove the external manifestation like BIBHU, like Shankar, like cauliflower-like growth, then what happens? The chief symptoms which helps us, which guide us that after administration of your medicine, the disease is curing from internal to external, following the healing law of cure, and the external manifestation will remove slowly, automatically, and the at last the spot remains in the skin until and unless the spot is removed from that particular part. You need to understand that still then the disease is persisting and you have to continue your treatment till the normal skin returns. So never apply external application, as the external application remove the chief symptoms of the disease. That is the identity. Hahnemann has written in 199 aphorism, the external manifestation in form of local disease. It is the identity of or characteristic feature of the internal existence of the disease. That's why it should not be removed by any means. Then complete eradication, the proof is the complete removal of the external manifestation, that is local disease. Not only removal, but the normal skin should be returned. So at last, in case of Shankar, in case of removal of the figured-like disease, the pink spot remains. That pink spot must be removed, and the natural skin must come. It is the indication that the disease has been cured, and that principle must be followed by homeopathic physician to establish radical cure. When internal disease increases, local disease also increases. Internal disease, as internal disease, it has directly related to the external manifestation. So after administration of your medicine, if it is not suitable medicine, then what will happen? Automatically, because of the existence of the internal disease, the external manifestation will increase. Then you can able to know that this is disease aggravation or medicinal aggravation. It is not homeopathic aggravation. Then you can think about your second prescription. You can think about your second step, how to manage the case. So removal of local symptom, remove the chief symptom. It should not be followed. Written in 2002 aphorisms. It is the most criminal procedure if you remove the external manifestation. In case of local disease, then Hahnemann is written, it is the criminal procedure. It should not be followed. It makes your case complicated. It affects the deeper organs. It is more harmful. So we should not follow these things. We have to consider the person as a whole on the basis of individualization, on the basis of totality of symptoms. We have to select a medicine. We have to select simillimum, then dose and potency, then proper repetition. And if the cause is miasmatic, then accordingly you have to treat the disease. And if it is artificial disease, for example, after taking some food or after taking some adulterated food, if local disease appears in form of allergy, then accordingly, as we are treating the artificial chronic disease, accordingly we have to treat, you have to stop the medicine, and that is removed by the vital force itself when medicine is stopped. To satisfy the patient, we can give placebo. If SORA is lurking behind, as it is written between 74 to 76 aphorism, if SORA is lurking behind it, then you can give antisoric medicine. Yes, local manifestation can occur because of the artificial means, if you take some things that disturb our vital force, it manifests externally and produce some allergic rashes, some allergic manifestation. The allergic manifestation we should diagnose, and again that external application should be prohibited, as we know that it is because of taking some food which is adulterated. Then we have to stop that food, that artificial food. Then we have to give placebo to please the patient. After that, we have to the vital force itself will overcome the disease force. And if because of long suffering the SORA is lacking, then you have to give antisoric medicine written between 74 to 76 aphorism. So the time is over. So I have already told that in footnote number 282, Dr. Hahnemann had only one place written that in old cases of what we can apply internal medicine as well as external application to the mother tincture, etc. Then you have to consider the treatment history like chronic disease, because local disease is one-sided disease. One-sided disease are all chronic in nature. Most of them are soric in origin, so we have to treat accordingly. So the time is over. Thank you very much for giving chance, and I hope definitely the concept will be clear by our all friends. So if there will be any question, you can ask.
Thank you so much, sir. Actually, we have only 5 minutes. In this 5 minutes, if anyone have questions, means you can ask. Participants, if you have any question, please raise your hands and ask question. Dr. Danesh?
Yes. Yes, BIBHU Prasad Panda sir, it's really a very good session. You really covered the science behind homeopathy and how one need to look into the case and to reach the correct remedy, and after getting the right remedy, how to prescribe it, and after prescribing, how to follow the same, and after follow up, what kind of potency you need to chase, and whether the potency, whether you need to give importance to the potency or to the medicine. That is more important. It is not the potency that we looked into, but frankly, the right medicine need to be selected. And once you give a medicine to a patient, what you need to is just to observe the patient, whether the medicine is working naturally. A patient coming after some 10 years of treatment may come to you, and the patient says that, oh, doctor, I am not getting any relief within 3 days or 5 days after taking your medicine. Then, as you rightly point out, that you have to mention to the patient that what is homeopathy and how the medicine works, and how the condition will be revoked. But one thing is clear, that if the patient, the medicine is right one, there will be some changes in the life of the patient, and then you need to look into the generalities to see whether there is whether the generals are improving or not. Then if the generals are improving, then you can think that the medicine is working. Am I right, sir?
Yes, sir. Yes, sir. Absolutely.
Since a lot, as just only 2 minutes, that's why I'm not coming up with any question. I think Dr. Ambaresh sir want to say something, or want to ask you something.
Oh, wait. Now you can unmute, sir.
Uh, Thank you, Dr. Dhaneji. Our congratulations, Dr. Madhav sir. Very good session, excellent session. Main cause of disease, according to law of homeopathic science, Sora, psychotic, and syphilitic. A main cause of internal cause, local diseases. Without Sora, no disease. Sora is mother of all diseases. Very nice presentation. There are symptom, soric, functional disease, psychotic, extra growth organs, and syphilitic structural disease. So, even medicine, miasmatic, according to miasmatic, king of anti-soric remedy is called name of sulfur, king of anti-psychotic remedy, puja, king of anti-syphilitic remedy, Mercol, and queen of anti-soric remedy, Sorinum, queen of anti-psychotic remedy, Medorinum, queen of anti-syphilitic remedy, Syphilnum. So very, very good session, sir, according to homeopathic philosophy of Rodin Bills. Very, very thanks, sir.
Thank you very much, sir. Namaskar.
Thank you, sir. Thank you so much. Actually, we need this type of class. We are not, most of us are concentrating in materia medica and clinical tips. We need philosophy and organon classes more.
Yes,
when-
sir.
Thank you so much.
Actually, madam, organon always give us direction. So
Actually,
without proper direction, we can success in
yeah,
it.
without any direction, yeah. That's true. That's true. Thank you so much for taking such classes, and we are eagerly waiting for your next class. Thank you so much, and good night, everyone.
Yes, sir.
Coming to Malayalam session, I'm inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, please. Thank you, sir. Thank you so much. Bye bye. Good night. See
Thank you. Thank you. Okay.